Knock, knock, knock. Hello, my name is Ben. I'll be your family nurse practitioner today. What's your name?
Hello, Jacob Delage.
And date of birth?
060497.
And what brings you in today?
Just my yearly physical.
Yearly physical? Okay. Can you tell me what year it is currently?
2024.
Perfect. So it seems to be that you're alert and oriented. I'm going to ask you a few other questions. Have you had any difficulty breathing?
Nope.
Any chest pain?
Nope.
Any pain in your hands or joints?
Nope.
Any difficulty eating?
Nope.
What about urinating? Any pain with urination?
Nope.
What about regular bowel movements?
Normal for me. Yep.
Okay. And no difficulty with activity or your work?
Nope.
Okay. Noting that the patient's posture is relatively stable and upright, that the hygiene is well kept, and that you're appropriately dressed for the weather, I'm going to move forward to checking your height and weight. So I'll ask that you stand up. And you're about 6 foot and 170 pounds. And then I'm going to check your temperature here with my tympanic probe and temperature of 98.8. And then I'm going to check your, palpate your pulse, radial pulse, and palpate that for 15 seconds and multiply that by 4 for a pulse of roughly about 175, noting the rate and the rhythm. And then I'll ask, just give you a distractor and count your respirations for about 30 seconds and multiply that by 2, noting the depth and the work of breathing. And now I'm going to move to your blood pressure. And since you've been here before, I don't need to do it both arms, and it looks like there's no articles of clothing blocking here. So grab my blood pressure cuff, and I'm going to palpate your brachial pulse here, and noting that your arm's at the level of your heart. I'm going to apply my blood pressure cuff 2.5 centimeters above the anacubal crease. And now I'm going to have you relax your arm a bit, and I'm going to palpate the radial pulse and inflate my cuff until I can't feel your pulse, and then slowly decrease my cuff. When I go to auscultate and inflate the cuff, I'm going to inflate it 30 millimeters of mercury higher than when I last felt your radial pulse, auscultating the brachial artery, and then releasing the blood pressure. Cuff slowly, and 120/80 is your blood pressure currently. And are you experiencing any lightheadedness or dizziness when you stand up from a lying to sitting or sitting to standing position?
Nope.
Okay, so if the patient was, then we would check orthostatic hypotension use the orthostatic hypotension assessment, and have you lay down for 3 minutes, check your blood pressure, change position to a sitting, have you sit for 3 minutes, check your blood pressure, and then have you stand up for 3 minutes and check your blood pressure, noting if there's 20 millimeters of mercury difference between either of those. And that includes our vital signs and general appearance for the patient. We're going to move to head, TMJ, and neck. So starting with your head, I'm just going to inspect your hair, noting from different angles whether there's any missing hair, the fullness of your hair, the coloration of your hair, not noticing any bald areas or any flaking or thinning of the hair. Then I'm going to inspect the scalp by parting some of the hair, looking at whether or not there's any signs of infestation, redness, or flaking skin. And I don't know any of that. I'll move to the skull next, noting the contour of the skull to be a normal cephalic, atraumatic. And I'm going to look at your skin, which seems to be fairly hydrated, no blemishing or damage from the sun, and noting the symmetry of your face, which seems to be symmetrical. And I'll go ahead and move to palpation of your head. And we're going to palpate the frontal, your skull, the frontal lobe, and the temporal lobes, and occipital lobes, noting any tenderness when I do the palpate your skull. Yep. And I'm not noticing any masses, nodes, or lumps. And I'm going to now move to your TMJ, noting your TMJ, whether or not it's swollen, if it's symmetrical, and then I'm going to palpate your TMJ and ask that you open up your mouth, noting any clicking, any pain, tenderness?
Nope.
Okay. And that's negative for that, for any pain or tenderness, so that's within normal limits. And we'll move on to your neck, which first I'm going to inspect your neck. So I'm going to inspect the symmetry of your neck, and next it looks symmetrical and no obvious swelling or lumps anywhere, nodules. I'm going to look at your trachea next, and it looks to be midline. Also, I'm not noticing any redness on the surface of the skin or swelling near the trachea. And then I'll have you look up to the ceiling and swallow, looking at the thyroid to see if it's visibly swollen or it has any signs of edema. And then I'll have you check range of motion by looking to the right and then looking to your left and looking down. And in noting any inability to do so would indicate a muscular issue maybe. At this time I don't see anything there, so we're going to move to a palpation of the neck. So we'll start with your lymph nodes. So I'm going to start with your preauricular lymph nodes, your postauricular lymph nodes, your occipital, then your tonsillar, then your submental, or your submandibular, then your submental, superficial cervical chain, and I'll have you turn to the left, deep cervical chain, turn to the right, deep cervical chain, and then check your anterior cervical chain, and then have you bring your shoulders forward and check your supraclavicular lymph node. Noticing any tenderness with that palpating?
Nope.
I'm not able to really palpate much of the lymph nodes, so they're not swollen or any signs of edema. I'm going to then move to the trachea. Have you look straight forward. I'm going to check with one finger anterior of the patient between the trachea and the sternocleidomastoid muscle, and it looks like the spacing between the trachea and the sternocleidomastoid muscle is equal. And now I'm going to move to behind the patient, and I'm going to check your thyroid gland. First, I'm going to palpate your thyroid cartilage. Below that is your thyroid gland, and then go one more below the thyroid gland to feel for the two first rings of the cartilage of your trachea. Move laterally to that with my fingers. I'm going to ask that you tilt your head and swallow, noticing any unequal distribution of my fingers or pressure. And then I'm going to palpate, deviate the trachea a little bit to the left and to the right, palpating the thyroid, noting any bogginess or indications of any swelling. Then I'm moving to the cervical spine, where I'm going to palpate the cervical spine starting from the hairline all the way down to between the scapula, where T1 starts, and then palpate the cervical muscles all the way back up for any tenderness or any discomfort with the palpation.
Nope, no tenderness.
Okay. And then if I note any tenderness or signs of edema with the thyroid, I would then auscultate the thyroid. Now we're moving on to the eyes, and I'm going to ask, do you wear any corrected lenses?
Nope.
Do you have any vision changes recently?
Nope.
Do you wear readers?
Nope.
Okay. So I'm gonna ask that you stand up, and I have I'm gonna start with visual acuity,
Okay.
and I have the Snellen chart over here. So I'll have you cover your left eye first and read from 20 feet away for the Snellen chart, the lowest line that you can read visibly.
DEFPOTEC.
And then switch eyes and do the same.
DEFPOTEC.
Now uncover both eyes and read the lowest line that you can read.
LEPODPCT.
Perfect. And it looks like you can visibly read line 8, which is a 20/20 vision. Now have you come back over here, and then I'll have you check, this is the Rosenbaum test.
Okay.
So typically, since you're not age 40, we're still going to do this though. I'll have you hold this out 14 inches from your face
Okay.
and read the lowest line you can read with both eyes open.
MHZEDR.
Perfect. And that's a 20/20 vision. So your visual acuity is 20/20. Now we'll move to your visual fields. So I'll have you just stare right at my nose here. I'm going to put my arms laterally to your ears and wiggle my fingers and tell me when you can see your peripheral.
Yep.
Okay, one more time.
Yep.
Perfect. Now I want you to cover your right eye. Covering my left eye, I'm going to do the same. Tell me when you can see me wiggle my fingers.
Yep.
Switch eyes. And tell me when you can see me wiggle my fingers.
Yep.
Perfect. So your peripheral vision's within normal limits. Now we're going to move to your color. So I'll have you look at that Snellen chart and tell me what that first color line is.
Green.
Perfect. And then that next color line?
Red.
So you have good color vision. So now we can move to just inspecting the eye itself. So I'm looking first at your eyelids. So looking at your eyelids, and thank you for closing them, I'm just looking for any notable asymmetry, any swelling, redness, noting your eyelashes and the direction of your eyelashes, if they're lateral or medial to your nose, and they look to be lateral, and they look to be full, nothing brittle, nothing sticking out as far as redness or swelling. Now I'm going to move to your lacrimal apparatus, which includes your lacrimal glands right above your eyelids. I'm not going to touch you just yet. Your lacrimal sac, and then visualizing your lacrimal duct. I'm not noticing any redness or injection of blood or any obvious edema. And then I'm going to your conjunctiva and sclera. I'm going to have you look up towards the ceiling. I'm going to pull down on your bottom eyelid, looking at your sclera, which seems to be white, and your conjunctiva, which seems to be not injected with redness or with blood. And same on your other eye. The sclera seems to be clear, no signs of jaundice, no signs of injection of blood. And then I'm moving to your corneas and lenses. I'm going to take out my scope. So I'm going to shine my otoscope oblique from the lateral side of the patient, checking the corneas and lenses for any visual scratches to the surface or damage. And then I'm going to do the same for the irids, checking to see if there's any casting shadow on the iris. And I don't know any casting shadow, which means your iris is relatively flat and that the shape of your eye is within normal limits. And now I'm going to check your corneal light reflex. I'm going to stand 2 feet away from you here, so this is roughly 2 feet. I'm going to shine a light at your eyes and note the symmetrical reflex on both of your corneas, and they look to be equal in both eyes and relatively same location. And we're going to move to the extraocular movements. So for this, I'm going to have you keep your head still. I'm going to have you stare at my finger with just your eyes. You're going to track my finger. I'm going to move it in the shape of an H. So first we'll move to the right, center, up, center, down, and to the other side here. Good. And I'm going to bring it in to check for convergence. I'm not noticing any nystagmus or lagging of the eyes. Very good, smooth tracking. And now I'll move to the cover-uncover test. And I'll have you just use this sheet of paper here. I'll have you cover one eye and just looking straight at me. I'll switch to the other eye. I'm noticing any deviation of the eye or sudden adjustments, and back over, and not noticing any of that. And now we can move on to the ophthalmic exam, where I'm going to dim the lights in the room for now so I can see your eyes better. I'm gonna dim the lights here, and before I do your ophthalmic, I'm gonna just check for your pupils quick too, since I have the lights off. I'm gonna have you look at my nose here, and I'm going to shine at your pupils and check for reaction to light, direct reaction, and whether or not the other side also reacts at the same time or constricts. Perfect. Noting the size, shape, and symmetry of the eyes. And with my pen light, I measure your pupils to be about 5 centimeters non-dilated, and then when they're constricted, they're 3 centimeters. And now, with the lights off, I can then start with your coronary light reflex. So I'll have you just look straight ahead over my shoulder here. I'm going to start from a 15-degree angle. I'm going to see if I can check for red light reflex in both eyes. Check the other eye, keep looking forward. And I note a red light reflex in both eyes. And then I'll place my hand on the patient's head. And then slowly close distance between my patient, looking into the retina, or looking at the retina, and the optic disc, the fovea and macula, noting any structures, the vessels and the arteries, noting any hemorrhaging or edema in the back. I'm going to switch to both this eye now, doing the same where I approach. Going a little closer, the retina, the optic disc, the fovea and the macula, visualizing those, looking at the arteries, the veins, and no, I'm not noticing any signs of hemorrhaging or edema. And that concludes our eye exam. Now we'll move on to your ears, nose, and mouth. So starting with your ears, I'm going to start with just inspecting your ears, looking at the auricle, the tragus, and the mastoid. Same thing, the tragus, the auricle, and the mastoid. I'm not noticing any swelling or obvious nodules. Now I'm going to move to palpating, and I'm going to palpate the auricle, tragus, the mastoid. Any tenderness?
Nope.
Same thing on this side. Auricle, tragus, mastoid. Any tenderness?
Nope.
And no visual redness. So now we're going to do check for your gross auditory ability. So I'm going to stand behind you about 2 feet. I'll ask that you cover your left or right ear. And I'm 2 feet behind you, and I'm going to whisper a word, and you tell me what I'm whispering to you.
Apple. Apple.
And then switch ears. Same thing.
Watermelon. Watermelon.
Perfect. Now keep the left ear covered, and tell me if you can hear me rub my fingers together.
Yep.
Switch ears. If you can hear me rub my fingers together.
Yep.
Good. Now I'm going to take my tuning fork. My tuning fork here, I'm going to smack it, and then I'm going to put, holding the base of the tuning fork, midline of your skull. And can you hear in both ears equally?
Yes.
Good. And do the same, smack it. And I'm going to put it on the mastoid bone, and tell me when you can't hear it. I'm going to count the seconds. 1.
Okay, I can't hear it.
Okay, and tell me when you can't hear it again.
Okay, I can't hear it.
Okay. Same on this ear. I'm gonna put my tuning fork on your mastoid bone. Tell me when you can't hear it.
Okay, I can't hear it. And I can't hear it.
And that just checks to see if there's a difference between you hearing the sound acoustically or through air vibrations. So, and your air vibrations are greater, so that's a sign that your hearing is intact. So we'll move to my otoscope next. And for my otoscope, I'm going to just shine and check the external canals. I'll be turning your head to the left a little bit. External canals. Those seem to be intact, no edema or dryness. Then I'm going to hold my otoscope to where I can stabilize it against the patient's head. And then I envision the cone of light and the tympanic membrane to be pearly gray and intact, no signs of rupture. And the cone of light shines at 3 o'clock. I'm going to stabilize my otoscope. Visualize the external canal. See the cone of light. Look at the tympanic membrane. It looks pearly gray and intact. And now we're moving on to your nose. So I'm going to inspect your nose and see that it's midline. And then I'll ask that you said you had some pressure or no in your nose before you didn't?
Nope.
Okay. So inspecting, seeing that it's midline, no visual blemishes or deviations of the septum. Then palpate your nose. So I'm going to palpate the midline, the cartilage. Okay. And then I'll have you cover one nostril and sniff, other nostril, sniff, checking for patency. And then I'm going to palpate the sinuses, your frontal sinuses, and then your maxillary sinuses. Any pressure or tenderness here? Okay. And I'm not noticing any obvious edema either, or any nasal drainage visibly. So I'll have you look up next. And I'll put my otoscope cover on. So I'll have you look up, and I'm looking for any nasal drainage, and I'm visualizing the turbinate, and then any septal deviation or scarring. No excess drainage. And where is... So that concludes your nose. We'll move on to your mouth. So I'm going to start with your lips, inspecting the outside of your lips. And they seem to be not dry, no visual lacerations, sores, or bleeding. So then I'll have you open up your mouth, and I'm going to grab some gloves for this. And have you open up your mouth. I'm just going to inspect your teeth, and I'm not noticing any dental caries, missing teeth or chipped teeth. Then I'm looking at your gums. I'm not noticing any redness, swelling, or visible issues with your gums. And then I'll have you stick out your tongue and then move it side to side. And I'm not noticing any swelling. And then I'll just stick out your tongue. I'm looking at the back of your pharynx and noting intact hard palate, soft palate, I can visualize your uvula and then your tonsils, which don't look swollen or inflamed. Now I'm gonna go ahead and I got my cotton swab here. I'm gonna wrap my cotton swab around your tongue. I'm gonna move your tongue to the side and to the other side, looking underneath. And then I'm gonna let go of your tongue with your cotton swab, throw my cotton swab away, or your 2x2, and I'm gonna then palpate your gums, and then underneath the integrity, and I'm not noticing any bogginess, any tenderness when I press down. Okay, so that concludes your oral exam. Thank you very much.